Ready to go, sir.
Yes, thank you. Thank you so much for this opportunity for me to meet with, I think it's the third-year students of the School of
Correct.
Medicine.
These are third-year students who are doing their clinical rotations.
Yes. So I was asked to speak about the role of big data in healthcare, and also to touch a little bit on what we are doing in the School of Applied Computational Sciences with big data in healthcare. So by way of touching on the role of big data in healthcare, I will focus on what some of our faculty are doing in computational sciences relative to big data in healthcare. And once again, this is a pleasure for me to meet with you. And alongside with me, one of my colleagues in the School of Applied Computational Sciences is also attending this meeting or presentation. And that's Matt Anderson, who is our Director for Communications and Digital Marketing within the School of Applied Computational Sciences. And has already been indicated, my name is Fortune Mhlanga. I am the founding dean of the School of Applied Computational Sciences. So my talk this morning, I thought I would just start by looking at some basic big data fundamentals, and then I'll move on to talk about the School of Applied Computational Sciences faculty role in healthcare. And I'll conclude by looking at some of the academic programming that we have in place, which is going to start in August 5 to be exact. So let's start by just looking at some basic big data fundamentals. So first of all, what is big data? You know, big data, I think as the name big, implies, it means this is of big scale. Defining big as well has to do with the diversity of the data, that the data could be of various, formats together. And what that does is it adds a lot of complexity. And with complexity, we require new architectures, new techniques to manipulate the data, to manage the data. We require, as we would say in computational sciences, new algorithms. It also requires analytics to manage the data. And this big data has a lot of value inside it that needs to be extracted in order to inform, the enterprise on which way are we going to go. The data that we mine from big data, or the information that we mine from big data, will inform on how the organization can actually move in the next 3 to 5 years. So it requires analytics to manage it and extract value that is hidden within it. And that value becomes knowledge that advises the organization. So speaking about analytics, here are some key questions that are addressed by analytics. Remember, I talked about the data and the information, that we get out of that data, the insight, which is relative to the value that we get out of the data. So with information and insight, obviously we can look at the past. That means events already occurred and they were captured as data. And when we look at the past, we can understand what happened after we manipulate, the data. When we manipulate the data, the information that comes out of it can inform on what happened in the past. That means we can have reporting tools that inform towards that. And the insight that we get from the past is, okay, how and why did it happen? And this comes as a result of some modeling that we do on the data, some experimental designs that we implement as algorithms and computer programs, So we can look at the past. We can also look at the present. What is actually happening now? And I'm sure with your iPhones, with your tools, mobile devices, you get a lot of alerts. And that is something that is actually happening now. And when you get those alerts, you come up with recommendations on, okay, what's next? What's the next action, best action that I can take with what I have been informed, right now, or with what I have been alerted right now. So with big data, as you can imagine, we come up with recommender, systems. Many of you with your mobile devices have either visited a shop. This could be a sporting goods, shop. And the moment you get in there, your system immediately knows where you are. And then it starts alerting you on products, within that store, or it might alert you with nearby, stores as well. So we can come up with recommender, systems based on the alerts that we get. The beauty of big data, and this is what separates big data or data science from other technologies that you may have heard of, like data warehousing, for example. What separates data science or big data from all those technologies is predictive modeling, looking at the future. Okay, so with the data that I have now, with the information that I have now, what is likely to happen? That means with that information, I'm able to extrapolate the future. And the insight out of it is going to be, what is the best case scenario that can happen, not just tomorrow, but it could be 3 years, 5 years, down the line. And what is the worst case scenario that can happen? So we are able to build predictive models to optimize information, to come up with simulation models of what is likely to happen in the future. And then when we come up with those predictive models, we can even now go further to come up with prescriptive models. That's now the various solutions that we have at hand that we can consider in order to either avert a situation, a bad situation that is likely to happen, or to reinforce, a good situation that is likely to happen. Okay, so what are some characteristics of big data? This question started with 3 V's. volume, variety, and velocity. When you look at volume, we are talking about the amount of data from myriad resources, from a variety of resources. So for example, I could say, well, we have 12 terabytes of tweets that are created, each day. That's the amount of data from myriad resources. Variety has to do with the types of data. Some of the data is structured, some is semi-structured, some is unstructured. You can come up with other terms, quasi-structured, and so forth. For instance, we could have sensor data, we can have audio, video, click streams, log files, and more. Traditionally, when we talk about data management, traditionally the data has been structured, and this is where you hear of terminology like relational database management systems. It is data that has been structured, that is related, and we can develop algorithms and manipulate the data in order to be informed with query results, and so forth. But actually, that's only about maybe 15 to 20% of all the data out there. So within an organization, which could be a clinic, which could be a hospital, which could be a manufacturing plant, they say that upwards 80% of the data has been untapped. And that 80% of the data is the semi-structured, unstructured, quasi-structured data, which has a lot of value within it that is hidden, that needs to be, to be mined, and will be able to inform the organization on how to move forward. So that's variety, the types of data. Velocity is the speed at which big data is generated. For example, we could say we are scrutinizing 5 million trade events that are created each day to identify potential fraud or fraudulent activities. Last summer, I worked on a project with other, specialists where we were collecting 5 gigabytes, up to 5 gigabytes of data per patient per day, and these were patients that were in an ICU. And we were collecting that, we were getting alerts, but that's huge data. That is big data. Here is Gartner's definition looking at these 3 V's: high volume, high velocity, and high variety information assets that demand cost-effective, innovative forms of information processing for enhanced insight and decision making. So those were the original 3 V's: volume, variety, and velocity. Volume obviously leads, like I said earlier, on one of the earlier slides, volume of data leads to complexity. And just look at some of these statistics here. Data volume has increased by 44 times from 2009 to 2020. And these are some scales of data volume. This image here, the digital universe, just shows how data has grown from 2009 to 2020. And data volume continues to increase exponentially. Now, when you look at terabytes, petabytes, exabytes, zettabytes, look at those in terms of as factors of 1,000. So, for example, 1,000 terabytes is equivalent to 1 petabyte, and 1,000 petabytes is equivalent to an exabyte, and so forth. So nowadays, for example, today, terabytes is the unit that is used to measure the amount of data stored by the average company today. So today we speak of data in terms of terabytes. When way back, like when I was in college, we would speak of data in terms of kilobytes or megabytes. If you had a megabyte, of data, you had a lot, of data. But today, we are talking about data in terms of terabytes. Really, what I am encapsulating for you today, each aspect could actually be a lecture where we introduce the data sizes, incrementally, so that we have a better understanding. But many of you understand some of these scales, already. Here is a quote. As a single human genome takes up 100 gigabytes. In fact, if you have access to these slides, you can click on this link and it will take you to the article, that is talking about this. You can click on that later. But as a single human genome takes up 100 gigabytes of storage space, and more genomes are sequenced, storage needs will grow from gigabytes to petabytes to exabytes and so forth. By 2025, an estimated 40 exabytes of storage capacity will be required for human genomic data. By the same token, variety also leads to complexity. Various formats, types, and structures. You're also talking about static data versus streaming data. The various formats, all this data needs to be linked in order for us to extract knowledge from it. So one needs to understand the pertinent algorithms that can link this data, and then the querying that is done in order to extract knowledge out of this big data. Velocity also leads to complexity. Data is being generated fast and needs to be processed fast as well. Remember, we talked about alerts, where we are informed, we are alerted, and we need in real time to act very, very fast. And that's what we call online data analytics, where we have real-time analysis of streaming data. And late decisions will lead to missing opportunities. And in healthcare, we could actually say late decisions could lead to death. So here are some examples, just a couple of examples that I pulled up. E-promotions, for example, based on your current location, your purchase history, what you like, we are going to send promotions right now for the store next to you. This is similar to the example that I gave earlier. Then in healthcare monitoring, for instance, I indicated to you that I worked on this project where we were monitoring and collecting up to 5 gigabytes of data per patient per day. Okay, so you can imagine the number of patients and then the number of days that we are working on that and how the data is growing exponentially. So in healthcare monitoring, for example, sensors monitoring your activities and body. Any abnormal measurements will require immediate reaction. And you can actually, since you are medical students, you can actually even help me understand that, even better. Okay, so some make it 4 V's. In addition to volume, velocity, variety, we also have veracity, which has to do about the accuracy, the goodness of the data. Some uncertainty due to data inconsistency and incompleteness, ambiguities, latency, deception, model approximations. This is what veracity is all about. So we would need to clean the data so that the data is as accurate and ready for analytics. And then some make it 5 V's, and I've sort of touched on this also already. So in addition to now the 4 V's, we also have value, that there has to be value in that data. And that's where data mining comes in order to get insights from the data. And then the V's continue to be added. Now we are talking about variability. That is the ways in which the big data can be used and formatted. Now I must say there is more to introduction to big data, but I only have a limited amount of time. And a limited amount of time to also say something and introduce something that makes a little sense. So now we may question ourselves, what is data science all about? What does a data scientist do, or what does a computational scientist do? It is all about understanding your business. Obviously, you must understand your organization. And organization could be any type of business. This could be a clinic, healthcare organization. It could be a business, a real business, commercial business organization. It could be a manufacturing plant. It could be an educational outfit, like a university, for example. That's the business that we are talking about. So understand your business, understand the business challenges or the business problem as a business problem, and then be able to take that business problem and translate it as an analytical problem. So you are essentially reframing your business challenge as an analytics challenge. And very quickly, this is where understanding of statistical analysis, decision modeling comes in. So with you as medical students, your business challenges are in the medical field. This could be cardiovascular biology, for example. It could be genomics that defines your business. But take that business, translate it as an analytical business problem, and translate it as an analytical problem or challenge, so that now you will be able to design, implement, and deploy statistical models, data mining techniques on the big data relative to that business problem or analytical challenge. That second bullet there says you not only need to know statistical analysis and decision modeling, but you've got to have an appreciation of some computer programming in order to develop the data mining algorithms and data mining techniques. Those data mining techniques are the ones that are going to enable you to extract insights out of the big data. That second bullet also says you must have an appreciation and understanding of data management, big data management in this case. And so I'm going to use that second bullet to also say that the three critical areas that are covered by data science, and also the three critical areas that would be integrated into the instruction, data science instruction, and then further to that, the three critical areas that we would expect a student that comes into a data science program is, okay, you must at least have some appreciation of statistics, going all the way to starting from descriptive statistics, moving on to how do I formulate a hypothesis, and how do I implement statistical models, maybe based on regression, multiple regression. All that materials is what's integrated in a data science curriculum. And then also the computer programming, understanding some pertinent computer programming languages, and then also data appreciation, data management appreciation, how to link, various data formats, and then creating queries that are going to manipulate that data. And then thirdly, after we have developed the data mining techniques on the big data, we will now, the data science or data scientist will be able to create insights that now lead to actionable recommendations. So many of you can think, for example, since you are in the broader, area of medicine, let's say back then we didn't know anything about lung cancer, back then. But back then, some statistical analysis was conducted where, several subjects were examined, some surveys were conducted, some desk study was done, maybe on various either patients or individuals. And then some data mining is done on that big data. And then the data scientist comes then and says to the physicians, or whoever is sponsoring that project, well, we did some data mining and we found out that there is very strong relationship between smoking and lung cancer. So that's the insight that we are getting from that study. And then we start now educating educating the population, that okay, this is going to be related to that if you do this, and so forth. So now let me look at the role of big data in healthcare, but for that I'm going to also introduce just a few of our faculty, some of the work that they are doing in healthcare. These are computer scientists, these are mathematical statisticians, and so forth, but that have embellished themselves in healthcare and are applying computational sciences in healthcare. And this will also help you to appreciate the role of big data, the role of computational sciences in healthcare. I'm just going to highlight 3 of our faculty very, very quickly. And really, I will be very, very happy to arrange, more tutorials by this faculty who are the real experts in what they are doing to really go walk you through on what they are doing. I'll start with Dr. Xinghua Wang. He is professor of computer science and data science in the School of Applied Computational Sciences. He's been looking at, I'm just highlighting some of the work that they are doing. They're doing much more than what I'm presenting here. Machine learning and its applications to the study of human disease. So for example, Dr. Wang's latest project is using deep learning, that's artificial intelligence, machine learning, natural language processing to distinguish measles rash from other skin diseases. He is an expert on cancer research. This is an individual that spent quite a bit of time at Sloan Kettering, which, as you know, is the #1 cancer research hospital in the nation. He was research engineer 3 there, just focusing on cancer research. And he's been looking at cancer genome sequencing, data analysis, and software development. He developed a software tool called Virus Finder to detect virus integration sites in human genomes. And this is one of the most referenced software tools, actually, in medicine. And he's upgrading this tool now for application to COVID-19. He is also working in, obviously, in personalized medicine. I have already touched on his work on genomic sequencing. And this is a slide that I obtained from him, which just walks you through how genomic sequenced data might be used to improve personalized healthcare, starting all the way when a patient meets with the healthcare provider. A sample is taken, a blood sample, is taken, then DNA is extracted and it is sequenced. Then the genomic mutations in the genome, they give a specific genotype in relation to the symptoms or diagnosed illness for the patient. That's steps 5 and 6. And then step 7, the structure and function that correlate to the genotype are used to guide treatment specific for that patient. Now, in order to do that very well, obviously you need the physician, but you also need a computational scientist, or the physician must have some understanding of an application of computational, science in order for that to really be realized. The second faculty member is Dr. Aize Kao. She is Associate Professor of Biomedical Data Science in the School of Applied Computational Sciences. She has done a lot of work on evidence-based clinical decision support and phenotype modeling for underserved populations. She is currently working on knowledge discovery. And in order to do knowledge discovery, you've got to understand artificial intelligence, machine learning, natural language processing, and she's using that to enhance clinical decision support. She has also done a lot of work on common data model frameworks for network studies. She has done a lot of work on Veterans Affairs, healthcare records, and she is now working to ensure that underserved populations are well represented in network studies using these common data models like OMOP, or Observational Health Data Sciences and Informatics. And pertinent to her work, we must understand electronic health records. So an electronic health record, or commonly abbreviated EHR, functions as an all-encompassing system that a physician can use to keep track of their patient's health information. And a robust and comprehensive EHR system will include a variety of information, including demographic information, contact information, medical history, allergies, test results, treatment plan, healthcare utilization, insurance physician, and some other insurance data, and other pertinent data relative to the patient. Obviously, there are challenges in that. Challenges that go back to those V's that I was talking about when we were looking at the characteristics of big data. Data quality and validation. The data needs to be cleaned, essentially, in order for it to be ready for analysis. Also, is the data complete? Sometimes the data is incomplete, and we have to do some inferencing, on the data. The heterogeneity among the systems, that means the disparate sources where we are collecting this data from, then systems knowledge, domain knowledge, domain understanding of the variety of data that we have. So there is a lot of research that is used, that is conducted using advanced methods in artificial intelligence, machine learning, natural language processing, and this research could lead to patient risk prediction, clinical decision support, drug studies, and so forth. The list continues. Then the third and final member that I will highlight is Dr. Vibhuti Gupta, who is Assistant Professor of Computer Science and Data Science. He has spent a lot of time looking at mHealth wearable sensor data analytics for early detection of adverse clinical events in hematologic cancer patients. An example of his current project, for example, he is analyzing continuous data, that is streaming, data that is captured from mHealth wearable sensor. For example, it could be steps, it could be sleep, it could be heart rate, using Fitbit and other longitudinal data like patient-reported outcome, survey questionnaires, and so forth that are captured from mHealth apps. And he's leveraging the mHealth wearable sensors data for diagnosis and early prediction of COVID-19. He is also looking at efficient information retrieval from healthcare medical records and analytical tools development. And this is just a graphic of an example of his recent work on the framework for efficient tweets retrieval using big data stream analytics, looking at its application for efficient information retrieval from EMR, that's emergency medical records, which are also electronic medical records, sorry, and further develop analytical tools useful for biomedical researchers. So when we talk about streaming data that he's dealing with in healthcare, for example, information streams, when we combine that with clinical information, that all that can paint a health graph of a given individual that updates in near real time with those alerts, and so forth. Then the correlated information chart can then be used for healthcare decision making. What is the importance of streaming data analytics in healthcare? Obviously, early insights into complex, life-threatening diseases. Proactive, we can come up with proactive treatment because of the predictive analytics that has been performed. We can come up with highly personalized, care for our patients. It is also useful for critical care patients in emergency situations. That's the role of analytics, and I'm sorry I'm moving very quickly here. I'm just going to spend a couple of minutes to talk about SAC's academic programming, the academic programming that we have in the School of Applied Computational Sciences. This fall, we are starting with a graduate certificate in biomedical data science, which comprises 18 credits. I'll talk about that in a little bit, and also a master's degree in biomedical data science as well. That's only in the biomedical data science program, which is specific to healthcare. I thought I would highlight just that program, but we also have a general data science, which is taken by virtually anybody, even those that are in healthcare. But the certificate, what do you get out of this certificate in biomedical data science? You will get an understanding of the nature and purpose of a range of standard schema, frameworks, programming languages, vocabulary, formats, models, and rule sets, an understanding of statistical difference between observations and variables, along with knowledge of the different scales of measurement, an ability to use a range of techniques and software tools for the storage, description, categorization, linking, and discovery of resources, an ability to pull data from disparate sources, an ability to apply knowledge of biomedical data science and mathematical statistics appropriate to the discipline. Then with a master's a degree in biomedical data science, in addition to those, you also gain an ability to function effectively on teams, an understanding of professional, ethical, legal, and social issues and responsibilities, ability to conduct a biomedical data science research and design phase of a real-world project, an ability to provide new solutions to complex big data issues, and an ability to implement and present a comprehensive real-life industry-type biomedical data science solution. Very quickly again, our master's and graduate certificate, in data science, the key features of those programs. We have expert data science faculty, and I think from the three that I have presented to you, I think you can just see by looking at what they are doing, these are experts in their fields. Fully online classes, professionals that are also taking these classes will enrich the class environment to traditional students, opportunities to develop a portfolio of a real-world experience through project-based research, taking real clinical data, for your experimental initiatives, interactive coursework and collaborative projects with students from a wide range of industry and geographic backgrounds as well. That's what you get. That's the enrichment you get out of this. The courses themselves, they range from computer programming. In fact, the first 5 courses that are listed there: computer programming foundations for data science, data conscientiousness, introduction to biostatistics, data management foundations for data science, statistical methods for biomedical data science. Those 5 courses are also integrated into the graduate certificate program. Then, in addition to those 5, just for the graduate certificate program, you choose a concentration track between precision medicine informatics and population health informatics, where you take the first course in that concentration track. So if you choose precision medicine informatics, you would take the introduction to precision medicine informatics. If you choose population health informatics, you will take the introduction course to that area. And this also talks about the admission requirements into our programs. But if you are students who are taking, who are already at Meharry, many of those admission requirements are waived because you have already been admitted to Meharry and you are choosing to take some select courses from our program. This is a schedule that you will also see on the, I don't need to go through it, but it shows you here. The only thing I want to highlight is that I have both programs here, the Master of Science and Graduate Certificate in General Data Science, and also the Master of Science and Graduate Certificate in Biomedical Data Science. You just need to follow through it to see the progression of courses there. So thank you so much. I truly believe that Meharry has limitless possibilities, that you as School of Medicine students, now with an additional appreciation of computational sciences into the various areas that you are studying, there are just limitless possibilities. And should you have any questions about taking some of our classes, you can contact Mr. Brett Ramsey, and I've given his email address there. So I thank you very much. I'm sorry I talked a little bit long, but Mr. Leland, I'll accord maybe the last 10 minutes or so for any Q&A questions from anyone.
That works just fine, Dr. Fortune. If any of y'all have a question, you're welcome to just unmute yourself.
Well, I don't know if you want to say anything, Mr. Leland.
I don't have anything I need to cover. It sounds like you must have answered their questions, because I'm not seeing any pop up in the chat box either. So thank you for your time, yes, Dr. Fortune.
Okay, thank you so much.
And you all have a good afternoon. I will see you in the morning, and we will wrap up Intersession.
Thanks. Goodbye.